So today I want to know what is diabetes. As you know, diabetes mellitus is a metabolic condition that occurs when the hormone insulin is not produced or is not sufficient or does not work properly. And there are two conditions, that is pre-diabetic condition and diabetes condition. If you find that if somebody has the fasting blood level, sugar level between like 120 and 126, then probably he is in that pre-diabetic condition. And above 126 milligram per deciliter, then he is already in diabetic mode, diabetic condition. So this is the thing, and reality is that 1 in 3 adults in America are pre-diabetic. Unfortunately, nobody knows, 90% of them, nobody knows that they are either pre-diabetic or diabetic. So I will tell in the coming slides, I will show how it is that people doesn't know how whether they are diabetic or pre-diabetic. So first, the purpose of today's presentation is to learn more about diabetes mellitus, to raise awareness among the onset of diabetes, and then to know the myths and realities about diabetes, and to understand the underlying mechanisms to learn how to manage the diabetic conditions. So I have put these in my talk: introduction, mechanisms, medications, myth and reality, and conclusion. So first I will go with the history of when the diabetic conditions were discovered and till date. So first, as you see, Oskar Minkowski Joseph von Mering, from German scientist, who discovered pancreatic diabetes in the year 1889, so almost 120 plus years. And from that time till the discovery of insulin, you see how many years? More 30 plus years. People were dying left and right, because if somebody gets the diabetes, they were dying. There was no cure for it at that time, till we get this discovery of insulin in the year 1921. Frederick Banting and Charles Best, they both were from Canadian scientists. They worked on that, and along with Frederick Banting and J.J. MacLeod, they were awarded Nobel Prize in the year 2023. And that was the shortest period in the history of awarding Nobel Prize for the scientists, which was only about 2 years, I think. Yeah. So the first discovery of insulin was in 1921, and then because after discovery that insulin was given to a 14-year-old boy, Leonard Thompson was the first human tested in insulin in 1922. And because it was not pure, he got reactions. He got allergic reactions, and he had difficult in surviving. In fact, he was about to die. But the purification of the insulin by James Collip, a Canadian scientist, purified that, and that purified insulin was given to this boy, and that he survived, and he passed away after surviving for 38 years. So that was purification of insulin. From that time to till 1959, when the disease conditions like type 1 and type 2 were diagnosed or discovered, during that time, so many, basically this insulin was purified from cattle, basically, and they were given to the human. And then in the year 1959, type 1 and type 2 diabetes were found. That was by Solomon Burson and Rosalind Yalow, from American scientists. And I will, in the next slide, I will show what is type 1 and type 2. Then in the year 1961, glucagon was introduced. Again, I will show in the other slides what is glucagon. And in 1966, first pancreatic transplant was done in the University of Minnesota Hospital. Similarly, William Beetham, Lloyd, Elio, American scientists, laser treatment was done for diabetic patients in the year 1967, and then in 1976, the first time the A1C test was developed at the Joslin Diabetic Center in Boston. Then after that, again after 2 years, the first human insulin was synthesized. How it was synthesized or produced is by recombinant technology, by using bacteria and introducing DNA into that and generating insulin, that is peptide hormone. That was first introduced in the year 1978. And then in 1986, insulin pen was developed, and followed by in 1990, insulin external pump. People use nowadays, many people use. That was developed in the year 1990, and then first inhaled insulin, also approved by FDA, was developed in the year 2006. Exubera, with the name Exubera and Afrezza. And then another stem cell therapy started in 2014. So still people are developing many pathways or many drugs and many antibodies to control this one. But as before this, from 1989 to 1921, people did not survive because, first of all, there is no medication, there was no insulin. Only when they came to know that insulin is the main producer of this hormone which can control sugar, blood sugar levels, or control diabetes. Then I will, in this slide I show that diabetes of two types. One is insulin dependent diabetes, and that is also called as IDEM, which is caused by low insulin production or insufficient insulin production. It also starts from hereditary factors, viral infections, mutations in insulin receptors. And this generally starts from the juvenile condition, from the birth and early stages of life. So when it starts with type 1 diabetes, there you have to use insulin, is a must. Without that, the kids or newborn will not survive. But the other type of diabetes, which is called as type 2 diabetes, this is non-insulin dependent diabetes, and then this starts by how you depending on your lifestyle, mostly sedentary lifestyle, which means that less physical work, eating and sitting, no physical work, no activity. That is sedentary lifestyle. And eating just and working from home, like nowadays is one of the thing what we are observing now. Mostly sedentary lifestyle, and kids are also busy in their phones. So that also becomes sedentary lifestyle of those kids. And sleep deprivation is another factor for that can also start second type 2 diabetes. Stress, another factor. Stress, either it is biochemical or other, like physical stress, emotional stress, familial stress, job stress, all those stuff comes into that stress. Diet, again, unhealthy diet, eating biryani, mandi, and whatever, all those high-fat diets, eating, that is also unhealthy food. And again, that with sedentary lifestyle, the persons are going to get the type 2 diabetes very fast. I will show in the next slides what is the age around that where type 2 diabetes can start. Obesity, the body mass index is another factor where you can expect that the person can get diabetes earlier than what the normal person gets. Comorbidity, if person has any health issues like respiratory problem, asthma, or cardiovascular disease, that also add to that. And of course, genetic factors later in the life stage, or if they have some birth, like parents, they have both mother and father, they have diabetes, the kids are also going to get, but unless it is completely regulated nicely, he or she is going to get early. So there are these two types. Now I want to show that prevalence of diabetes all over the world. I am surprised to see that Pakistan is number 1, where 26 to 30% of prevalence of diabetes is there. And then comes Egypt, and you can see French Polynesia and Kuwait, all this. So here again, you can see some of the countries which is having like 6 to 10%. America has 11 to 15% of prevalence, and is going to go in. It is estimated that about 11.3% will go by 2030, and 12.2% can go to 1245. But the surprising thing, as I said, the Pakistan or other Asian countries where it is high. So I want to show in the next slide that why it is so high there. Reasons. Tradition of eating a lot of sweets in South Asian countries, particularly India, Pakistan, Bangladesh, China, and Sri Lanka. Now you can ask me why China and Sri Lanka or Bangladesh they eat sweets or more sweets, but China they don't eat much, but their staple food is rice. That's nothing but carbohydrates. So that is the reason they also have high relevance there. And also another reason is the big cities going to late functions, as in India or Pakistan or Bangladesh, late function, dinner parties, and eating heavy fat or heavy food. On the top of that, eating rich food and sweets, also prefer to drink carbonated drinks like soft drink, Coca-Cola or Pepsi, whatever. That is also rich. I will also, in the last slide, I will show how much each soft drink has sugar in that. And going to bed immediately after returning. That means no physical exercise. Coming late, eating so many things, drinking soft drinks, and again going to bed without any physical exercise. So that is nothing but a sedentary lifestyle. In big cities, stress, particularly mental, emotional, family, and physical stress, also as another reasons which can start diabetic conditions. So diet, sedentary lifestyle, stress play an important role in the onset of cardiovascular issues and diabetic conditions. Now after this I will want to show the mechanisms. In mechanisms, when it starts, here I am showing that insulin is produced from beta islet cells in the pancreas. Again I will show in the next slide, coming slides, what is beta cell and where is pancreas, the organ which produces the beta cells. And beta islet cells are very sensitive to increased oxidative stress and nitrosative stress, that is biochemical stress, like free radical generation and again free radicals generation that kills the cells, those beta islet cells. And insulin supply and demand make more beta cells to produce more insulin. That stress, overloading of production of insulin also can kill the beta cells. In pathological conditions, beta cells work hard to produce insulin and may start dying. And once they start, the islet cells start dying, there is no point of return, and pre-diabetic condition kicks in.
What is islet cell?
Islet cell, that I am going to show in the next slide. Okay? And if not managed at this stage, it may lead to diabetes. So here I am showing here, again I am not going to go in scientific details, but as you asked, insulin is a hormone produced by endocrine glands. The pancreas is one of the endocrine glands which produces insulin. These are the cells, I don't know, it has laser pointer, no. These are the cells which produce, this is beta cells which I am going to talk, alpha cells and acinar cells, delta cells. But insulin, regarding diabetes, I will be talking only beta cells and some introduction with glucagon. As I told, glucagon is also a hormone that regulates the production of glucose or blood sugar. So you can see where the pancreas is lying in the digestive system, which releases all those enzymes and hormones in the small intestine. That's where the food is digested or absorbed, like that. So that is the pancreatic islet cells. The one you see, that is a pancreatic gland, and if you see on the right side is a cross section of a normal pancreatic gland. You see there so many beta cells, the blue colored ones, are beta cells in the normal islet cells. And in type 1 diabetes, where beta cells are all destroyed or died, you see only few of them. So that's where insulin is required there. Without insulin, the person cannot survive with type 1 diabetes. This is type 1 diabetes. Without insulin, person cannot survive. So that's how the things. So once what happened in type 2 diabetes also, the cells start dying with all those stress what I listed in the previous slide. With that, the cells start decreasing, and they are so sensitive. Once they start getting start dying, then they will not reproduce. So all these medications, either they stop the dying of those cells. All these medications what people take with diabetes, either they stop, or they stop there. If not, they already start dying. So that's the only thing where they can control or check. But once they start dying, there is no way we can stop dying of those cells. I mean, we can stop the dying, but we cannot reproduce them. They will not generate. So from there, the insulin deficiency starts. And from there, either you take insulin, or if it is in pre-diabetic condition, you can work out or reverse it again completely, not completely, but you can use doing every precaution, you can maintain that part. But if you leave it like that with sedentary lifestyle, everything, the cells start dying, and at one point you have to take insulin.
At what A1C it start dying? Like it what?
A1C is not cell.
Yeah, I understand that.
Islet cells.
Like how do you know when it start dying? Like because the normal A1C is from 517 to 6 point.
A1C is hemoglobin, glycated hemoglobins. Those are not cells. Those are the number. When the sugar increases in your blood, they bind to hemoglobin. That is one of the biomarker which shows that either pre-diabetic or normal or diabetic. So that, but these are the cells which produce insulin. A1C is the result of other thing. Yeah.
When do you know that it start dying?
Oh, again the symptoms.
The
Symptoms will show. Until unless you take care from the beginning, regular checkups. So what is your A1C or what is your blood sugar?
Like,
Yeah.
How do you know where is your A1C? You think like one number is your A1C.
Below 5.4 is good. This is the normal one. Above 5.4 to 5.7 or 6, you will be in pre-diabetic. After that, again, 7 and above is again diabetic conditions. You will see that. So, but by that time, cells started dying there from there.
So, difference between type 1
Yeah.
and type 2
Yeah.
diabetes is the amount of beta cells that have died,
Right.
right? In, obviously, type 2,
Mhm.
less.
Less,
died.
yeah.
So you still produce some insulin, but
Yes,
okay.
it's not sufficient.
Okay, is that correct?
Yes.
But type 1,
Right from the beginning, he has to
that means that
take the insulin is required because insulin is not produced.
Okay.
Very small amount is not sufficient, so he has to be given. The kid has to be given the insulin. From that point. And
when you have type 2
yeah,
and then the cells are dying at the beginning,
yeah,
you stop that.
yeah. That's what. If you take care,
Yes.
utmost care,
How?
by checking your sugar regularly, not eating extra carbohydrates, sweets, rice, those things, and take extra. You can take energy from different sources, not from carbohydrates. Only carbohydrates will make your blood sugar goes high.
Can you give some example of carbohydrates?
Next slides I will have that. Yeah.
Is it less production of insulin or insensitivity of
Both. Less production, or if it is producing, it will be insensitive. So both conditions. Yeah.
You have some questions?
Yes.
What is the inhaled insulin?
Which one?
The first.
Yeah.
inhaled,
Right.
Myself,
Inhale.
I have type 1 diabetes.
Right.
I've never heard of the inhaled insulin.
Yes, just check. It is there. It's available. It is available. Yeah, approved by, yeah. Yeah, just you can, yeah. Right.
I have a question.
Yeah, please.
I'm wondering, like, when you go to the hospital, they
Yeah.
check your A1C,
Right.
and they say that you are pre-diabetic. But
Right.
when your blood glucose, it's not high, it's not showing that you are pre-diabetic.
Right.
How would you?
Actually, the A1C is taken for the past 3 to 6 months. 3 months, at least 3 months during that time, because sugar can increase. Next slide I will show you. Sugar can increase by any mean, but whether you are pre-diabetic, the A1C measure will give you accurate response, accurate levels of whether you are pre-diabetic, no diabetes, or diabetic.
Okay, but it doesn't show that you have when you do your blood
Right.
blood
Blood,
it doesn't show that you are pre-diabetic, but the A1C.
with A1C, yeah, because as I said, you eat anything, drink sugar, coffee or tea with sugar, suddenly your sugar increases. So that is not the correct measure. But for the past 3 months, how your blood sugar level is there or not, that will show. It takes the average of for the past 3 months and shows that whether, and when they measure A1C, that shows that from the past 3 months, either you have high or low or no, normal.
And then for if you said that the cells start dying when you are diabetic,
Right.
when you hit diabetes. If we do cell therapy,
Right.
would that be able to regenerate this?
Again, those are still in trials.
Okay.
Yeah. I told that was only in 2006 they started. Some stem cell therapy is going on. For some people, maybe it's working, but again, it's not completely as other medications are helpful. They are still in that stage. Clinical trials, or what you say. For some people, maybe it's working.
Have you tried xenotransplant?
So all those things, again, that level, they're not in pub market. It's not. They are not in the market, but they are at the research level, or for clinical trials they are in.
But it work or it not?
Yes, yeah, right. So now endocrine glands. I'm just showing again the pancreatic islets. Same figure I'm using here. But what is endocrine gland? So there are 3 types of signaling. How the hormone, not only pancreatic, other hormones also, but here I'm taking the example of pancreatic cells, how the insulin is produced by the one single beta cell. If it is producing and acting on the same cell to mediate the effects, that is called as autocrine signaling. And if it is produced and it has effects on other cells, it's called as paracrine signaling. And then when it's produced and goes to other parts of the body or other organs, then it's called as endocrine signaling. That's where endocrine glands are, beta cells produce insulin that is released in the blood and reaches throughout the body. That's where we say endocrine gland, the pancreas. And again, autocrine signaling is same thing what I'm showing here. Intracellular signaling means the cell has so many receptors. You can say hormone or medications or drugs, how they act on the cell and send the signal to the nucleus, to the DNA or the gene. That makes the RNA, and RNA is transcribed to peptide. That is, peptide is nothing but insulin, and released outside the cell. That goes in the bloodstream and reaches wherever it has to go. So this is how the cell makes insulin. Okay. And now I will show acute blood sugar. Sister, you are here. So you can see sudden blood sugar levels can increase by either heat stress, artificial sweeteners for some people, not all. For some people, coffee also can increase the sugar level. And sleep, very important, that too little sleep can induce insulin resistance. As brother asked, insulin resistance can, with less sleep, insulin resistance can develop. Skipping breakfast. Many people they think, okay, now better they skip the breakfast because of the obesity or any other reason to lose weight. Skipping breakfast is not good. What happens? You starve from breakfast time to lunch time, and suddenly you eat food, lunch, heavy lunch maybe most of the time. When you skip, you definitely you will eat more in lunch, or if you skip lunch, you eat definitely more in dinner. So what happens? The rush, the demand of insulin when you eat, sugar level goes high. Suddenly signal comes that okay, insulin is required. So they have to work extra work to produce more insulin. Again, that may start killing the cells, beta cells to kill this one.
Two questions. One, insulin resistance is
Yeah.
a suppression of insulin production?
No,
No.
sensitivity.
Okay.
Yeah, they will not act on the function of converting extra sugar to glucagon. Glycogen is not taking place.
Okay.
That's where the levels increases.
Okay. And that,
Because in general, what happens when extra sugar is in the body, it converts. Insulin converts extra sugar to glycogen in the liver. Okay, but that sensitivity will go, and the blood sugar level will be high, even in the presence of insulin.
and so that's because there's too little insulin? Is that
It's not functional. It's not functional. Brother.
So why many people say that fasting, I mean, when we fast, we all of a sudden you have this rush
Yes.
in sugar level.
But again, if you are fasting, better instead of fasting, you can eat small portions. 1/2 fruit, some other thing, half banana or 1 banana, like that. But you don't starve yourself. But when you starve, you want to eat whatever is in front of you. That will surge the push.
So about the Muslim fast, when we fast
Yes.
from dawn until sunset.
Right, that is good. But again, if you start eating heavy, iftar or sahur, at that time, there is chance. But since you starve for the whole day, fast for the whole day, that will be taken care, the balance, I can say. But regularly I am saying that somebody wants to skip breakfast, they suddenly at lunchtime they eat more.
There are a lot of diet people who say, oh, skip breakfast because this is how you can let the body get rid of the fat.
But again, if you are not eating double the food what you skipped at lunchtime, otherwise it will be same. Rush, demand of more insulin production, more stress on beta cells.
So what you're saying is that you should eat small meals.
Yes,
rather than-
yes. Every 2 hours, every 1 hour, like one cookie or like that, or any other thing of that kind.
That's why when fasting says you fast on something light,
Yeah,
go to prayer and just come back.
exactly. Yeah, right. Yes.
There's also some scientists who said that for breakfast it's best to have salty food than sugary food.
Yeah. Again,
Like having something that's not sweet in the morning. Like you can have omelette, egg,
yeah,
but not
protein. Yeah.
not something that has sugar.
That again depends on age.
Okay.
If he wants to eat, he can eat as much as he can, but not you and me.
Don't encourage him.
No, what I'm saying. Yeah. So. Yeah. Exactly. Right. Okay. I will show you in the next slide. Coming slides, I will show you. Brother, you have a question?
My question number 2.
Yeah.
All the diabetic people try to keep the artificial sweetness
Right.
for the
Yes, yeah.
So,
Mhm.
so you say that is also not a good thing?
Again, for some people, you have seen that it can raise blood sugar level for some people. But again, if it is taken like, you cannot take just making sweets with that and eating, that is not good. Yeah.
So, sorry, as
Yeah.
you said heat.
Yeah.
What kind of heat are you talking?
Temperature like
Like Like
people
shower,
working in the
or are you
outside
talking
field.
about outside?
Yeah,
The-
so that stress again.
Or you,
basically
or
thinking.
There could be a shower.
No, I don't think so. The other, people working throughout the day on the roads or, laborers, for them,
It can increase.
stress. I mean, not for all, again, for some people, depending on, it varies from person to person.
Okay.
Same thing, I may not get what you will have the effect on that with those conditions.
Doc,
Yeah.
just to clarify.
Yeah,
In the morning,
right.
you have salty food and then you follow with a little sweet, right?
Well, again, if you monitor your blood sugar, depending on that, you use that one. If you are normal, you can eat sugar also in the morning.
Doctor,
So,
for
no.
this particular person over 50, you should stop eating sugar, right?
Which one? Next slide. Okay. Okay. Yeah. Coming slides. Okay. Okay. Another time of the day. Sometime daytime, the sugar can get higher, and the sunset or dawn, again that also varies. Dehydration is another one, because when you dehydrate, the concentration of the sugar will be high. If you take water, it will be diluted. Nasal spray, some antihistamines, some allergic medications, people spray a nasal spray. Again, it depends on for person to person. Not everybody get that effect. Gum disease. This is another important part where it can complicate the diabetes and increase the blood sugar. So these are acute effects of increasing blood sugar. But as sister said, these are the things which can increase. But A1C measure gives the correct sugar level of your for the past 3 months, how much it was, that gives the correct exact value. So next I want to show early signs of diabetes. That for your question, that early signs of diabetes start from varies to person, that is for sure. Normally it may start between 30 and 40 years of age. Okay. That's where if you don't control at that point, and also one of the thing, what the next thing is that people, nobody knows that they have the diabetes till they see the symptoms, and at that time you measure the sugar level, it will be more than 300 to 400. Then only you will feel that okay, something is wrong with my health. Till the time you don't go to the doctor, you don't check your blood glucose level, only that starts between 30 and 40 years. Somewhere it can start any time, depending on your comorbidity and health conditions or genetic factors, but generally it starts around that time. And if you don't care in those years, monitoring in those years, then you will be completely diabetic. By the age, if it starts 30, by 35 you will have complete diabetes. If you start 40, you will be 45, you will be complete. Then from there you have to take care. So nobody, again, as I said, nobody knows that whether they have diabetic or pre-diabetic until unless the sugar, by the time you check, it will be 300 plus. And the symptoms are like fatigue and low energy, feeling hungry and thirsty. Please.
Are these like the symptoms for type 1 or type 2 or both?
Which one?
For these symptoms, which type of diabetes is it for?
See, if somebody is having type 1, this doesn't matter. Insulin is a must. Okay? These things automatically that will be taken care if somebody is taking insulin, right? So for this, because this is for type 2 diabetes. Yeah, that will start around that time. If they don't take care, then it will continue. So, and feeling sleepy for within 30 minutes, because after you eat, within 30 minutes the sugar level just shoots up. Then you feel sleepy. If you feel sleepy after taking food, within half an hour, then you are either pre-diabetic or diabetic. So if you are comfortable, you are fine, no problem. But that is one of the symptoms what you can see. And craving for sweets. You want to eat sweets, chocolate, whatever. That is another reason for one of the signs. And frequent urination, bleeding gums, sudden increase or decrease of body weight, and waist size. This is another reason you can check your waist size. If it is increasing with all the other symptoms, that means you are diabetic. Okay. And several other indications are also there, that including what I have presented here.
How can we explain the decrease of body weight?
You measure, right? You feel, right?
But how can we explain that? Because gaining weight,
Yeah.
like increase on body weight, that can be explained by you cannot digest.
Because the levels, the hormone production, because there are two hormones, glucagon. I probably in the coming slides I will be telling that glucagon, which produces glycogen, which helps to break the stored glycogen from the liver whenever it is required. When the sugar level goes down, glucagon acts on the liver storage. From there, it breaks that and produces glucose. So that helps that. But extra sugar is taken care by insulin. It stores, and glucagon it breaks. So that balance is always there. But some hormone is not working, then increase and decrease of these symptoms you can see.
And why is it only on the increase of body on the waist size? Why?
Fat deposition. Again, those things will,
Why is only on the waist?
Fat increased. Fat is produced.
But fat can produce, when it's produced, it can disperse anywhere.
Anywhere, but mostly to immediately what you can see in the waist. It shows up in the waist first.
The waist size thing means.
But according to body, right? Yeah, you can see obese kids.
Yeah, I mean, aren't we the most obese country in the
Yeah.
world? So that means that a much larger, I think you were saying this, a much larger percentage of our population is diabetic.
Diabetic.
Than actually.
They can check their waist, normal waist size, and you can see the waist size. By that, of course, other symptoms also. Not only just waist size, other things also. Just take care of those things, and these. If you see the other symptoms, then you can also correlate those symptoms with this.
So it's not just one.
No. Just all together. Yeah. Then, when diabetic condition happens, so these are the complications in the later part of your life, or as that disease progresses. It can go to stroke, heart attack, or peripheral artery disease, and diabetic retinopathy, cataracts, and glaucoma, and diabetic foot. All this diabetic nephropathy, peripheral neuropathy, all those get affected. Question?
If diabetes go through stroke, does that mean that diabetes go through the brain?
Because the accumulation of so many things like H1B and other glycated end products, they get accumulated, they go to the brain, and they break the function of those. So deficiency of oxygen may take place there. So that will affect the brain. That's one of the part, and you can see it affects all the systems. Circulatory, respiratory, and excretory, and okay.
All of these symptoms, or these later diseases, are because of the increased sugar in the blood?
Sugar, because of sugar, because
Imbalance into the hormones.
no, of course, the reason is imbalance of the hormones. Will keep the sugar level high all the time. That's where it goes to 300, 400 and above. That makes
The sugar is basically, it goes up.
What it does, it breaks the fine arteries in the eyes and wherever. So that breaks, blocks, breaks. That's where even neuropathy, the tingling in legs, that means neuropathy. The cell, the cells will die. The neuronal cells in the leg, they die. That's why you won't feel sensation. So that is neuropathy. So all these conditions in extreme diabetic conditions, brother.
So does it matter what kind of sugar you are having, whether it's sugar from the fruit or just normal sugar?
Actually, if you compare sugar, the purified sugar what you put in the tea or coffee, it goes 100% in the blood sugar within half an hour.
Okay.
Yeah. But if you eat, these are called simple sugars. But if you eat fruit, it has complex sugars, a mixture of all, simple, complex, and more complex. So they break slowly. Okay. But this goes directly into the blood. Because pure, processed one. Processed one, it just goes into the blood.
What about brown sugar?
Little slow. Slow. Yeah, that will also go, but it breaks slowly. Yeah.
How about honey? That was my next question.
Corn. Yeah, again, as I said, again, all vegetable, fruits, if there you get carbotic. Yeah.
Honey.
Corn. Honey, again, it is not simple. It has some simple, but most complex sugars are also there. More complex sugars are there. Yeah. If you compare sugar with honey, of course, honey is better.
So the fruits, sugar from the fruit?
Yes, that is also. That's what I'm saying. Simple sugars is the pure sugar which you eat that goes 100% into the blood level, blood. But the other ones, they go slowly, they break slowly, they give you energy for a long time.
Yes.
But if you eat sugar or drink, within it goes and suddenly within half an hour you will feel hungry again. It won't stay here. Yeah.
My observation here
Yeah.
about the so-called juice, American juice.
Yeah.
It's not really juice, it's fructose corn.
Yes.
Highly processed.
Added, yes.
Something they are drinking. I think one of the reasons that is causing this extra weight.
Yeah, right.
Size.
In the last slide, I have that information. I will show you that.
Excellent.
Yeah. So now the medication part, how to control, and again I will start with the history, what type of medications started and now what are in the market and like that. So these are the medications and the group of medications. First they started with sulfonylureas, of course insulin, then sulfonylureas, then thiazolidine and biguanidine, and then SGLT2, that sodium glucose transporter inhibitors, and then sitagliptin and DPP4, dipeptidyl peptidase inhibitor, and then stem cell, and now other gene therapy and insulin, this one, related drugs, again insulin, short and long term, those were developed. So as I said, in the 1889 the pancreas, the diabetic was discovered. At that time, only from that period to till the discovery of insulin, so many deaths occurred, and in the year 1940 they first produced these sulfonylureas as a medication. Then 66 pancreas was transplanted again. That was also another treatment strategy. Human insulin synthesized in 1978. Then comes the bioguanidines that contains metformin, Formamed, Glumedzar, Riomed. And here with sulfonylureas in 1940s, glimepiride, glipizide, glyburide, and tolbutamide. All those are the one group of compound, and that one another group of compounds, and thiazolidine another group of compounds. They came up in 1990, and insulin, of course, in 2000, purified one for injectables, and then in 6 inhaled insulin, and 13 another group of compound sodium glucose transporter inhibitors, and then followed by another DPP4 inhibitors and stem cell. So like this. Now what it does, GLP-1, glucagon-like peptide, increases insulin production. What are those GLP agonists? They are semaglutide, Ozempic, what you are seeing, their hot market of those drugs. Ozempic and semaglutide and Rybelsus, those are the ones. And the latest ones, which were approved by the FDA in 2019. So they produce insulin production is increased, glucagon secretion, that is inhibited. Otherwise, as sister asked, glucagon secretion, blood sugar which is stored is broken by glucagon, that is inhibited, means insulin is increased and the glucagon is decreased there.
If you do sports,
Uh-huh.
will it take away or add?
No, it will take away. Yeah, you should be doing all the time. Okay? Yeah. Even if you eat anything, sports, physical exercise. And it also curbs the appetite. You reach satiety. Okay, sister.
Is there any side effects of the inhaled insulin?
Side effects of insulin? No.
Of the inhaled one?
Inhale one, again, because this is pure insulin, there are no side effects. Yeah.
Does it work, the inhaled one?
They are claiming, and some people are just using those ones.
Is it for type 1 or type 2?
When you are taking insulin, early stages, it is type 1 for type 1. But you can take for later stages, once you develop diabetes in late, like after 40 years, 50 years, whatever. That is type 2.
The thing is, like, for example, for type 1,
Mhm.
you eat any carbs,
Yeah.
which increases your blood sugar level.
Yes.
So when you take the inhaled
Mhm.
one, would it have the same effect which you
Yes, same effect. Yes,
Same
yes.
effect.
Because it goes into your blood. It goes into your blood and reaches all the organs wherever it has to go, right? Yeah. So, and A1C will decrease, and insulin in hypoglycemia. It decreases insulin in hypoglycemia. When the blood sugar is low, insulin production is also inhibited when you use GLP-1 agonist or drug. So that's how the control. First, these are the medications which people are using from almost 40, 60 years, but these are the new ones. The GLP-1 is a hot thing, market, semaglutide, Ozempic, and also what they found that Ozempic or semaglutide, they also has weight loss programs. It is having. So basically, it is called as repurposing of the. Originally, it was for diabetic, type 2 diabetic medication, but they found that it has additional effect, weight loss. So the people with obese people, they are using to lose the weight.
So, Ozempic
Yeah.
is not in here. That's why, but that is GLP-1. right?
Yeah, right. Yeah.
It works like an appetite suppressant.
That's GLP-1s.
The Ozempic.
Ozempic, yes. Yeah. That's where you lose the weight. You feel full. You reach satiety and then you will feel that, oh, I'm full. That's where. Yeah.
What is going on with scarcity of insulin in the United States? It's always in
Cost.
And the cost, is it big pharma trying to make money? Is it too much diabetes? What's going on? And then how much is it a hype for pharma to make money versus like really treating people?
But insulin is not for making money. But those ones to lose weight,
Yeah.
right? They are doing for making money, I think. So.
We don't know even the insulin, right?
Well, it's not insulin. Again, it is completely different, right?
Okay.
Yeah, it reduces sugar level, but at the same time, you are losing weight.
But it's always in the news they increase insulin price. Is it not?
Is it? I don't think so. Insulin is whatever the price they have
Few
just
years ago,
Yeah.
right.
there was a shortage of insulin on
Maybe because of that, yeah. That's conditional, right? So it's not, but yeah.
I think still there are different kind of, like I get insulin, there are two types of insulin.
Short, and long, yeah, exactly, yeah. So
sometimes it takes like a week for them to.
yes.
And sometimes for someone, for some
Right.
CVS or pharmacies,
Yeah.
you can go and get it. But for some like PIOS,
Right.
it take a week for them to order, or they're short. They have to find around the area to find something.
Exactly, depending on the insurance and depending on the location of the pharmacy.
They don't have it. They don't have.
It's just magic.
The Adlog, it's easier to get it. PIOS,
Mhm.
take like a week or 2 weeks
Yeah.
for them to order and to receive it.
Yeah, that is their whatever the problem, their management or production or yeah, that's condition.
Do we know the long-term effects
Mm-hmm.
of Ozempic? How safe is it?
It's safe only. That's why people are using, right? They want to lose weight.
We know the long-term impact.
Oh, again, see. You see, in the beginning, like 1940, they started. Metformin started in 1960. Still, people use because that's the safest one. I mean, not much risk. So people have different risk side effects, but again,
Ozempic, we don't know.
no, because that's again, it's only 5-6 years, right?
Yeah.
So again, you will see in the coming years. Yeah. So
Just will be tested out.
yeah, right.
Yeah, Ozempic it may cause a thyroid cancer.
That is a side effect of that thyroid cancer. That's why people want to.
Any drugs, if
You have something or the other. Yeah.
any drugs that can cause side effects.
Side effect.
Because you're changing the body's mechanism.
Yeah. Yeah. So then now, where those drugs work, like I said, AGEs, that is advanced glycation end products. Accumulation of those end products in the brain may cause diabetes of the brain or type 3 diabetes, it's called, termed as type 3 diabetes, because of accumulation of advanced glycation end products in the brain. Similarly, with high sugar, protein lipid combination, those advanced glycation end products are produced, which can be accumulated there in the brain. And similarly, metformin, again, the functions, it works on hepatic glucose production. Okay, it inhibits hepatic glucose production. And glucose, the glucose inhibitors, those inhibit reabsorption of glucose. So extra sugar is excreted from the kidneys, but the problem is sometimes you may go hypoglycemic. That's why it is not, people with chronic diabetic condition, they take those inhibitors. Okay.
So the CGL2 inhibitors, it
Yeah.
goes through the lungs.
No, those are kidneys.
The tooth?
Those are kidneys.
Oh.
Those are kidneys. So it goes out through the urine.
Oh.
Yeah.
So does that use any oxygen?
For
Like the CGL2, does that infect any
it,
oxygen?
oxygen is what? It's not medicine, right? Yeah. It is just oxygen molecule, air, yeah, combination of all the stuff, air, right? Oxygen is good because the blood has to exchange oxygen, takes oxygen, make hemoglobin, right?
So when you say that metformin insulin sensitive, what do you mean by that?
Again, it is not effective. Even the insulin is produced, it becomes insensitive, non-functional. Yeah. And these are the one how all those medications work on the systems. Okay. Yeah. Sorry.
In your opinion, what type of insulin or like way to get insulin, like by the pen, pod, or the inhaler, like which one is the best one in your opinion?
Again, your physician, primary care can suggest you. Again, I'm not physician, so okay, I cannot recommend. So these are mechanisms of actions on every organ or tissues and how these medications work. Now, people think that, okay, I think there are so many home remedies, herbs that can control. And metformin is also produced from plant only, right? But the problem is that you can eat these plant or leaves or flowers, but you can get control. But there is a possibility risk of overdosing, right? That's why it has to be isolated, synthesized, and fixed amount of dose has to be given to the diabetic patient. Otherwise, risk of overdosing may, make the person hypoglycemic or sometimes even go in coma as well if it is decreased below that. So all these medications, what I have shown in the previous slides, all are either synthesized, isolated from the plant, extracted, identified, isolated, synthesized, and then used for this to fix the dose depending on the person's body mass index and how much he required, what is the blood sugar level, that is fixed based on that one. So people say that, for example, one of the experiment here, see, over 10-year treatment period, metformin weight did not gain. Diabetic patient did not get their weight over 1 kg. However, other medications, glibenclamide and insulin increased the body weight of 6 kgs and that 3 kgs. So in that case, metformin is safer, particularly in maintaining the body weight.
Was metformin recalled at some point, right?
No. Again, still there in the market, still the safest medication, only depending on your primary physician, because there are so, as I showed you several medications, they act differently. So for you, which one is required? Sometimes if I say that this medication is not working to you, or you get some allergic reaction or side effects, your primary will switch to other medication. If it is safe for you, if you don't get any side effects, then you can continue with that. Again, if that is also not working, see the other ones. So your primary care can decide based on your sugar level, your A1C level, that can be done by your physician. Which one is suitable for you? Okay. So everybody cannot take metformin. Some people they take. If somebody, for some people metformin is working, for others it will not work. They will go for other glimepiride or sitagliptin or pioglitazone. So all those different medications. And Januvia, again, late chronic conditions, people use Jardiance and Januvia. So all those different pathways, it acts on different pathways where the signal or the control to keep the sugar level in check. Then myth and reality. Here is the main gist of my talk, is myth and reality. As I said, that people think that home remedies, particularly neem, karela, this is bitter gourd, we can say methi, fenugreek, and cinnamon, can, as an alternative medicine, people think that, okay, why should I take medications? I can use these things and control my sugar level. So generally, these things can be taken in a preventive phase. Once a person gets diabetic, these will not work. These will not work. They may decrease your sugar level acutely, but they are not going to affect this one. Again, sugar level will go high. So at that time, you have to take medications. So people think that herbs or home remedies can check the diabetic condition. It's not. And also people say Unani and Ayurvedic medicine, that will also decrease the diabetic or other disease conditions. That is also, again, as I said, preventive measures, okay. But once people reach the diabetic condition, it is difficult to check those things as well. Like medication given by some healthcare professional, hakims or other, what you say, mullah, maulvi, whatever. And people go to them with 100% surety that, okay, if he gives and he challenges that, okay, take this, whatever medicines he gives, tell that 100% is cured. But that is not true. So, that is again myth. And allopathic medicine for diabetes are not effective. Many people think why to take drugs, home remedies, this and that. If we take, that is helpful rather than taking any medications to treat this diabetes. And again, there are several medications available in the market. But if you are taking a medication which is not suitable to you, you blame that, okay, that medication is not working. If you take another medication, the alternate one, that will work. So, you cannot blame that whatever the medications are, if it's not working for you, it doesn't mean that it is worthless. It has for some people it is good. And the reality is this one. Pre-diabetic conditions may start around, as I said before, 30 to 40 years of age. Many people don't know the onset of pre-diabetic conditions until their blood glucose level reaches 300 to 400 milligram per deciliter. So, for example, nobody goes at the age of 30 or 35 to the doctor and check the blood level, right? If he is in sedentary lifestyle, he should go and check his blood sugar level. I'm sure within that range, it can show up. Your A1C can show up, or even acute blood sugar level can show up that, okay, this is this much. So, but nobody wants to go around that age. And critical, if you feel that if you, from 35 to 45 years, you should be more cautious to consume more carbohydrates. You can decrease carbohydrates, increase your protein level or fat you can take. But you have to decrease significantly the carbs.
Why this age is most critical?
Age?
Yeah, 30 to 40.
Because the production of insulin is high when you are young. And slowly it decreases production.
Start decreasing at that age.
It decreases, yes.
Excuse me.
Yeah.
So do you consider aspartame
Yeah.
as simple sugar?
Yes, it is. Again, as I said, too much is not good. You can take once in a while. Yeah.
So when they say zero sugar in
Yeah.
Diet Coke, they put aspartame.
I will show you the next slide I have. So, yeah, these are the reality that people should think that around that age they should monitor. If they feel that they are pre-diabetic or sugar level is high, they should immediately start taking care. And again, another risk factor is comorbid conditions. If you have any problems, heart and respiratory or other, then again, that also you should be, then it can start early, so you should be very much careful in that area as well. And lack of awareness, access to diabetic and other cardiovascular conditions, and lack of biological or biology information and education also will keep general population aside, thinking that, oh, okay, I don't have, even my parents, they don't have diabetes and I will not get. It's not that. It is your lifestyle, particularly the type 2. Your lifestyle that can bring you diabetic condition sooner than later.
So I have a question.
Yep.
For example, like someone who is not obese,
Right.
and he is in a good health,
Right.
Less weight,
Mhm.
and physically active,
Right.
can thyroid cause type 2 diabetes? Thyroid, low thyroid or high thyroid?
Again, completely different. Diabetes is because of insulin issues, right?
Yes.
High blood sugar.
Yes.
That is completely, thyroid hormone is completely different story.
So it's
It can add to some phase it can add to that, but it's not responsible. What I mean to say. Thyroid is completely, is different.
Okay.
Yeah.
And some people say, like for type 1, they say it's environment. What does that mean?
For type 1?
Yes. Some people say,
Okay.
Is it the food? Is it the air? I mean, I don't understand. Like, you ask the doctors, they say it's the environment.
Because the pollution in the air, it has so many xenobiotics. Those are chemicals which act as low level hormones. That makes the difference. And as you can see in America or developed countries, in comparison to back home, there are like breast cancers because of that hormone. Those chemicals act as xenobiotic or female hormones, estrogens. That's why they have this cancer, breast cancer, here in these developed countries, not back home.
Same thing with like type 1, I see there's a lot of developed countries, Australia,
Yeah.
UK, America. Type 1 is much more, probably, I don't know if these less developed countries, they might have it or they cannot diagnose it.
I think they won't diagnose. They don't go and they say that, okay, the kid born and died within 2 days, 3 days, 4 days, right? But they don't know whether he's diabetic or not.
But sometimes I see that some people with type 1, they could be diagnosed in 25 years. It could be 30 years. It's not just the kid.
Again, that's what I'm saying. Either parents, if it is coming from genetic, hereditary.
If it is not genetic, like my daughter.
Sporadic. There is another possibility. Sporadic.
The discussion can go forever.
Sporadic also.
I just want to know, like.
It can have sporadic, yes. Sporadic also. Yeah. It can go in that way as well. Yes.
If you have like pre-diabetes, what can you do to prevent it?
If somebody is pre-diabetic. Again, taking care, what I have shown. Yeah. And again, a couple of slides are coming there also I suggested. But these are the reality, what are the myth. People think that one, and this is the reality. And how to take care of that part. So I'm going to show in the next slide.
Can we reverse it?
What? If diabetes is there, it cannot be. That's why the myth is there that if you go to any Maulvi, Mullah or...
Wait a second. Mullahs don't diagnose.
No. They give medical Hakim. I mean Hakim. Even Mullah, I'm not Mullah, Babas. What I can say, Babas. They can say, okay, I'm doing this, it will be gone. Again, I'm sorry, I use Mullahs. Sorry.
Diet would not help to reverse it.
Once it starts, you cannot reverse it. That's why in the beginning I told, when the cells, islet cells beta cells start dying, you cannot regenerate those. That means whatever the amount of insulin is producing, those living cells, it remains that much. Either you have to take something on top of that to maintain that. Otherwise, they will start declining. The number of beta cells start declining, insulin level goes down. To maintain that, physical activity you have to maintain, dietary this thing you have to take care of that, and in addition to that, you can add some medications. You have seen that will also support to maintain that level. If not, they decline. Yeah.
Can the questions be to the slide, and at the end probably will be a few questions generally?
Yes, right. Okay. Why not finish? Yeah, we can finish this. So, again, to avoid take-home message is that one should pay attention to portion of their food intake after 50 years of age. Okay. After that, you should take care of your food portion. You cannot eat more, and particularly carb, rice or sweets. You have to decrease. And you can take the other source of energy or protein or fat. You can take. Okay.
What is omega-3?
Yeah, these are fatty acids, the fish oil. Fish oil, yeah. Fish oil, and you have in other vegetables means olive. They have walnut, yeah. So all those have omega-6. And that is a chemical structure, name of that fatty acid. And there are two or three types of fatty acids, so combination of balance of that will show in the next slide when we eat. So eating fish at least once, not more than 2 times per week, that will also take in the levels of requirement of omega-3 is taken care.
Why not more than 2 times? Because of mercury?
No, not because of mercury. The blood thinning, they will start, the RBCs start dying. I mean, breaking. The membrane becomes fluid. So that is not suggested. So 1 or 2 is sufficient. Yeah.
Any type of fish, doesn't matter.
You can it shows salmon has more, and I think sardines. So yeah, right. Yeah, in fishes. Yeah, right.
But why fish cause blood thinning?
If you excess of these fatty acids, the membrane of the cell membrane becomes loose, it breaks.
Over the arteries and the whole body and stuff.
Yeah, blood cells. I'm talking blood cells. Yeah. So bleeding can occur if you take more. Yeah. And again, diabetic patients must be cautious in their dietary habits and overall lifestyle. And regular checkups are important. We can delay, again, as a sister I told, we can delay the onset of this pre-diabetic condition, live a happy life, and move forward with healthy aging. That is where important. Everybody has to, die, but you should live for a long time in a healthy condition. It's not that 30, 40 years you are taking somebody's help. No. Just live as much as healthy aging you want to live.
I just want to mention that.
Yeah.
Our scholars tell us that if you don't take care of your health and don't get regular checkups,
Right.
you are not following Islam. You're not following Islam. Islam wants you to be strong.
Yeah.
I'll talk about this in my talk.
Right.
You have to take care of your body because when you get sick, you get less useful
Yeah.
within the community.
Right, exactly. So again, I'm emphasizing that once this process of cell death starts, beta cells, there is no way we can reverse it. And taking medication and consuming sweets, Shoaib sir, taking medication and consuming sweets and desserts with high sugar content is not going to work. So you have to completely check at that point. If you are pre or diabetic, you have to completely stop taking simple sugars. You can eat fruit, but again, portion size is important. When I say you can eat fruit, doesn't mean that you eat, so many fruits at a time. So just portion size. And now, here's an healthy and unhealthy foods I'm showing here. So the Western diet and Middle Eastern diet. What I'm showing in Middle Eastern diet, what we have is omega-6 is high, and here also omega-6 is high, omega-3 fatty acids are less. That's where the problem is. And here, what happens if you have more omega-6, then pro-inflammatory molecules, cytokines, prostaglandins, leukotrienes, thromboxanes, they all are produced and they are responsible for arthritic pain, arthritis. That's what pro-inflammatory cytokines lead to those pains. That's where you should reduce the omega-6 fatty acids and increase the omega-3 fatty acids. And healthy food, what I am showing here is where 2:1 ratio. You can see salmon, all fruits, vegetables, some bread, some flax seeds, and walnut. Those are healthy ones you can take to keep the levels of omega-3 in balanced state. And of course, physical activity is a must. Otherwise, eating that burger, beef burger, and with the mandi, again, you are going to increase omega-6, and the pro-inflammatory molecules will generate, leading to many disease conditions. and added sugar, as I told the brother that how much sugar is added in the cold drink like Coca-Cola or hidden sugar, 26% in Heinz tomato ketchup, and all those, you can see how much it is there. Of course, I thought of putting something on over it. I'm not saying that somebody should drink wine. So these are the healthy cone where you can eat a few times per month. Red meat, eggs and poultry a few times per week, fish, olive oil, and yogurt and milk and legumes, fruits, all those things are healthy. But again, those two are the one which with extra. On top of that, people drink Coca-Cola or Pepsi with so much sugar in it.
Can you address one thing? Isn't it? All right, I have friends who do this, and I'll tell them you're a fool for drinking Coke or whatever. We should boycott it.
Right.
For health reasons.
Yeah.
Then you're like, oh, I drink Coke Zero, right? Or I drink sugar-free Coke. That has got to be a myth. That has got to be complete nonsense.
Again, you cannot drink 10 cans of sugar zero, right?
But, okay.
Yeah. So one maybe,
can,
or not every day, maybe.
You can drink regular Coke too.
Yeah, but again, that will increase your sugar level. That's what,
So
you are increasing.
Will Coke Zero not increase your sugar level? Will not contribute to diabetes?
No, the level, again, the next slide I will show how much it is there in that.
But it has aspartame.
Yes,
And then
yes.
aspartame, there are some studies that says it can cause cancer.
No, again, as I said, if you are using aspartame in everything, making cakes or drinking and everything, again, moderate level. It is not carcinogenic.
But is aspartame considered simple sugar?
It is amino acid. It is amino acid. So it is one of the.
It's not sugar.
No, it is sweet.
Okay.
It is not sugar. It is sweet, but it is amino acid.
It's
Yeah.
not simple sugar.
It is simple sugar only, but it's amino acid. Sugar is not. That is not sugar. It is sweet. A chemical amino acid which is sweet.
Okay.
I will show in the next slide. So these are the ones which I want to show. So here you see how many sugar in Coca-Cola or orange soda, how many grams of sugar is there.
That's the regular Coke, right?
Yeah, regular Coke, yes, regular Coke. Yeah.
About the Diet Coke or like Coca-Cola or any diet soft drinks, does it affect your blood sugar the same way if it's not diet? Because it's still, when you drink it, still tastes sweet.
Yeah, that's what aspartame is sweet. It's not sugar, but it's sweet. And I will, in the next slide, I will show you that people take equal or sweet and low or what's that, stevia or those things. How much sugar they have, how much sweet they have. So I will show. So these are, you can see how many grams of sugar or teaspoons per any drink they have.
Affect your blood sugar or no?
Huh?
Does it affect your blood sugar, diet ones?
Those were not. Those will not. But again, yeah, those will not increase. Yeah. But you cannot consume a lot.
So when we talk to the doctors for the kids, she recommended that anything with 5 grams or low is better. Would you say the same?
What?
5 grams of sugar or low.
Because they produce so much insulin, they burn, they play, so whatever they eat, it will get digested, metabolized.
If they exercise, but some kids don't.
They become fat again. The accumulation, that's fair, yeah. They become obese. So this is what I'm showing the alternatives, how much sugar, how much sweet they are. And as you can see here, 200 times more sweeter than sugar, aspartame. If you eat sugar, they're 200 times more sweeter than sugar. Okay? That's why if you take 1 teaspoon and you take this much, the sweetness same. Yeah. So that's 200 times more. and Splenda 7,000 to 13,000 times sweeter. Same way with sucralose, that's equal, 600 times sweeter. Same way stevia, yeah, 200 to 400.
Quantity of sugar, these are 600 times or whatever.
Sweetness, I'm talking about sweetness,
So
yeah.
put much less.
Less, yeah, to get the same sweet.
But these are not calories.
No calories. Sweetness, yeah, right.
Potency compared.
Yes, exactly.
But do they, so this, like aspartame, do they go fast into your blood?
As I said, it is amino acid. It's not sugar. It's amino acid.
Okay, so they don't go into
No. That's why it's safer.
Oh,
Yeah.
okay,
Right.
they don't go into your blood.
Right.
Yes,
Yeah.
okay.
They are excreted also.
Huh?
They easily go out. They are not absorbed. They are not metabolized.
So if you have to make a choice between simple sugar and this,
For example,
this is better, right?
better, but again, only if it's required.
If it's in,
If a diabetic condition, then only.
okay.
But if you can avoid sugar, you can take this also.
Okay.
Yeah. And what I was saying, the size of the molecule is high, and they are not they won't break with the enzymes present in your body. They give the taste of sweet and they go out without breaking and absorbing. Or maybe few percent may get absorbed, but most of them it goes out without absorbing.
So just to be clear, if I understand, if you have a choice, let's say you have a rush,
Right,
maybe
yeah.
you fasted or whatever,
Right,
you
right,
have a
yeah,
rush and need
yeah,
the
right.
sugar. What you are saying is it's better to use this alternative than the simple sugar.
Now at that time, if you are hungry, definitely you need energy. This will not give you energy. This just goes out. It gives taste to your tongue, but it goes out without giving energy. Yes, sir. People are saying, but if you take in moderate, it is not. It is mostly safe. They are safe. Again, as I said, some reports are there, but again, not for particular thing. There are, because they are they are in bigger size. That's why it get accumulated. Then local problem they may create, because they are bigger than sugar molecule. They get accumulated. But again, aspartame or aspartic acid, that one is again it is not. Yeah. But other things, yeah.
Are there any side effects for these? Any side effects?
Only if you add in everything, like making cake with these things, the amount you are consuming. If it is small, because it has to go out, it will not stay. But if you eat more, they may get accumulated in the body somewhere. Then the possibility of doing something wrong.
So what is the take-home message about this substitute? Should we use them or not?
Better not to use.
Okay,
I suggest you.
that's what I want.
Yeah, just avoid. You within 3-4 days you will get accustomed to, or you used to taking coffee or tea without sugar, or you will enjoy. Yeah. So right. So I suggest not to take. Yeah.
Many people, we have to break the
Yeah.
sweet tooth that we have,
Right.
particularly from countries in
Yeah.
Asia.
Right. Yeah.
We have this sweet tooth.
Yes.
If you visit the Far East,
Right.
China or
Yeah.
Indonesia,
Yeah.
or Asia,
Yeah.
they don't
Yes.
like sweets. And what they call sweets, it's very lightly.
Yeah.
And
Right.
most people in this country, when they cut the sugar,
Right.
they finally said, I don't like sugar.
Exactly.
If you cut that habit
Yeah.
for 30 days,
Yeah.
you will change your life.
Yeah.
And
Yeah.
that's the best thing
Yeah.
you can do for your health.
You can.
I learned to drink tea without.
That's very good.
I never thought I could do that, and I enjoy it
Yeah.
without any sugar.
Just think in gulab jamun or jalebi or any other sweet, how much sugar is there? So this is the one, and the people still use like 41% they use Splenda and all those they use. But again, it's better to avoid them rather than eating them. Yeah.
They taste so bad. I don't know how people like enough.
Exactly.
As soon as I put one sip
Right.
of any of these sugar substitute, I cannot finish it again.
Yeah, right. Yeah, right.
I don't know, just how people like it, I don't know.
Yeah. Any question? Yeah, sister.
Can high blood sugar level, high blood sugar in your blood affect your hearing or not?
It affects everything. I told you, it can affect everything, because the molecules, the glycated sugar coat attached RBC, they make the blood thick, and they they break the thin arteries. They kill the cells, neuronal cells, they kill the arteries, everything happens. That's where the retinal wall, there also, it just, the blood, thin, minute arteries, they will break. That's where you lose your vision. Yeah. So the message is that, yeah, better to avoid. If you are pre-diabetic or diabetic, try to avoid is good. But if you want some sweetness, probably you can use, but again, try as much as to avoid these artificial sweeteners. So with that, thank you, and I think I have taken many questions, but if you have anything, please. Thank you all for your time, and thank you so much. Thank you so much. Yeah, please.